The head of an independent panel investigating the WHO's response to the COVID-19 pandemic has told DW the pandemic could have been avoided had China acted sooner. Former Liberian President Ellen Sirleaf also pulled up the WHO for not having labelled the outbreak a health emergency and a pandemic earlier than it did.
If China had given information on some of the early findings about a breakout, if WHO has had the effectiveness for a timely and effective alarm system, yes, it could have been avoided. I think our report is very clear.
The report here is a preliminary one that was made public earlier in the week. Now, Sirleaf heads up the so-called Independent Panel for Pandemic Preparedness and Response, along with former New Zealand Prime Minister Helen. China responded to some of the findings in this report.
As the first country to sound the alarm against the pandemic, we took prompt and decisive measures, even though we had incomplete information at the time. We should, of course, strive to do better. I think any country, whether it be China, the US, the United Kingdom or Japan, every country should strive to do better.
Let's get some perspective on this from Dr. Clare Wenham. She's an assistant professor of global health policy at the London School of Economics and has been following the course of this pandemic over the last year. Dr. Wenham, welcome. Now, Ellen Sirleaf told our channel that if China and the WHO acted in time, this pandemic could have been avoided. Is that a fair assessment, you think?
I don't think it is. I mean, I think there's some things that we know China could have done quicker. So we know there were some delays in notifying the World Health Organization about this outbreak and maybe recognizing the severity of this outbreak in the early stages. But you have to remember that they were, the first country to ever have seen this. They didn't, it could have been nothing. They were, juggling all these things. So whilst they could have acted sooner, China, we also, shouldn't necessarily suggest that any other country wouldn't have done the same in their position. The challenge I have is suggesting that WHO should have acted sooner. I think WHO has done everything they could have done in this outbreak. They, convened an emergency committee. They declared a public health emergency within a month of notification. Now, yes, it took 2 meetings over the course of a week or 2 weeks to get this declaration. But if you think about the Ebola outbreak, for example, that was almost 8 months after the first case that we had the public health emergency of international concern declaration. So I think they acted quite quickly, and they have been nothing but consistent in providing the best evidence and the best guidance to countries across the world. I think the reason we're in this situation, I don't think it's necessarily China and WHO. I think it's that countries didn't listen to the WHO, right? Countries didn't respond quick enough when they said, this is an emergency, prepare. Countries were complacent, particularly countries in Europe, North America, who had never really experienced a major pandemic or epidemic before, just sort of waited and didn't really do anything. And the only things they did do was stopping travel from China, which we've seen and has been widely shown to be ineffective.
Yet the report says that the WHO's alert and response system is archaic and, quote, needs to be brought into the digital age. Now, you mentioned the Ebola epidemic. I'd imagine that given an epidemic like the Ebola epidemic or the Zika virus, this would already be a done deal.
So again, that's the part of the report I don't agree with so much. I think the WHO system is quite, forward-thinking. They have the Go On network, which, collaborates data reports from across all sources using, internet mining, using reports on something called ProMed Mail, which is where doctors can share information with each other. And so actually, I don't think, again, that's the problem. For me, the problem here is in governments responding to that information when they have it. Fundamentally, knowing about this virus a day or two sooner wouldn't really change the way governments then responded to it when they had that information.
So what is the role that the WHO is playing over here? If you are saying that the problem lies in countries not acting fast enough, what is the role that the WHO is playing?
So I think the WHO is caught between a rock and a hard place. It's an institution which is a member state institution, so it relies on and, informs member states. But it's also, it should be empowered by member states. At the moment, what we're seeing is member states across the world departing from WHO advice, charting their own course, taking national approaches rather than thinking about the global level. And I think this raises a much more important question about the role of the World Health Organization. How do we get governments to both give it the political power to be able to make the decisions, then follow the guidance, and importantly, how do we get governments to pay it so it can, pay it properly, so it can do all the things that the world expects it to do?
Briefly, is there a political will you find to at all reform the WHO so that the WHO has more teeth, as you suggest?
The WHO has been reformed for decades already. The problem is that the way it will get reformed is through governments agreeing to it at the World Health Assembly. At the World Health Assembly, it's one state, one vote, and member states then vote it in. The problem is it's quite hard to imagine a situation whereby governments will give greater power to the World Health Organization. And in doing so, that implies that they are then going to cede some of their own national power to be able to make decisions independently as sovereign nations. So they really have to recognize the benefit from a public health perspective that can come from having one global actor making the best public health decisions. But as we know, these decisions aren't just about public health, they're also about the economy. And so that's where it gets difficult. And this is the real problem.
Dr. Clare Wenham from the London School of Economics, thank you so much for joining us.